More than 71 million Americans depend on Medicaid for health care and health insurance. And even some Senate Republicans are worried about what those cuts would do to people in their own states.
New tonight, Eyewitness News reporter Solomon Ladvinka looks at what's inside the bill that's causing the biggest divide. Solomon?
Michael Rochelle, a dramatic weekend in Washington as senators race against the clock to deliver President Donald Trump's big, beautiful bill. The president hopes to have his 940-page legislation passed by July 4th. The House nearly passed on its own version last month. Now it's in the hands of the Senate to make changes before it goes back to the House.
I hope that what we're going to receive is a product that is substantially similar to what we sent over in the House.
Senate Republican.
Here in California, state representatives, Republican and Democrats, are gridlocked over the details. In a Zoom panel Monday night, as California health advocates sound alarm on looming Medicaid cuts terminating health care for millions of Americans, California Representative 10th District Mark DeSagne says the Democrats need just 3 votes to help swing this bill.
This is really horrible. The one thing in terms of operations, when this bill passed out of the House, it passed by 1 vote. We need 3 Republicans to vote against it. David Valadao, who's a key target here, and I've had some testy conversations with David. I've known him since I served with him in the legislature. And I've been on the health committees in every level of government.
Congressman David Valadao says, "I have been clear from the start that I will not support a final reconciliation bill that makes harmful cuts to Medicaid, puts critical funding at risk, or threatens the stability of healthcare providers across California 22. As the Senate continues to work through their version of H.R. 1, I'll keep working to ensure Medicaid is available for our most vulnerable." More than 71 million Americans depend on Medicaid for health care and health insurance, and roughly 42 million Americans rely on the Supplemental Nutrition Assistance Program, also known as SNAP, for food assistance.
I recently saw a graphic that I really felt summed up how these proposed cuts to Medicaid affect all of us, regardless of whether you have Medicaid or Medicare. So 41% of all births in the U.S. are covered by Medicaid.
The Senate parliamentarian says the Medicaid overhaul featured in this big, beautiful bill does not adhere to the chamber's procedural rules. Still, Congressman Vince Fong is optimistic that the president's agenda will be approved, despite controversial cuts to Medicaid.
And so that's what we're trying to do, is to ensure that the federal funds that go to the state of California, that they actually go to eligible recipients and to vulnerable populations that need it. That's what we're trying to do. And as I said before, we're going to continue to spend more money on Medicaid to ensure that those who are eligible, they get the health benefits that they deserve.
Now, under a state budget deal signed by Governor Newsom, the state will stop enrolling new adult patients without legal status in its state-funded health care program for low-income people starting next year. Reporting in studio, Solomon Ladvinka, Eyewitness News.
Hi, I'm Rochelle Murcia with Eyewitness News Bakersfield Now on YouTube. Thank you for checking out our YouTube channel, where we have tons of great content to choose from. While you're here, go ahead and click on the subscribe button right there. That way you can stay up to date on all the things related within Kern County. Thanks for watching.